Well, thank you for being here. My name's Nick Daniel, and I'm a director of product at Arcadia. And today I'm going to be talking about empowering health equity, advanced strategies in SDoH and SOGI data integration. And I've already won the award for longest data byte title, so we're off to a swimming start. So it's important to set the foundation, right? What are social determinants of health? I'm sure many folks are aware of this, right? But social determinants of health are factors in your environment that can affect your health and well-being, right? We have all of our clinical data, we have all our claims data, but social determinants have a huge impact. And I love this quote from the Harvard School of Public Health. Your zip code is a better predictor of health than your genetic code, which is just so interesting to think about. And somewhere the Neanderthals are looking down at us saying, see, I told you, it wasn't our fault, right? It was our surroundings. It had nothing to do with our genetics. But these 5 groupings are kind of the agreed upon buckets of those social determinants of health. Healthcare, access and quality, right? Are you able to see your provider, in a timely fashion? Are there providers around that are providing good quality care? Your neighborhood and built environment, do you have access to transportation to get to these interactions with your providers, to get the services that you need? Do you have access to, to healthy foods, to green space? You have social and community, right? Do you have a community support system where you are able to engage with your community in a positive fashion, or are you isolated from that? I think COVID really showed us all how important social and community can really be to one's health and state of mind. At least I felt that way. Economic stability, that's probably the most straightforward of the bunch, right? Do you have a job? Are you employed? Does that job provide you with, the income necessary to afford your lifestyle without going into extreme debt for medical debt or otherwise? And then lastly, education access and quality, right? What is the quality of education that is available to you publicly? Do you go on to advanced schooling or vocational schooling or otherwise? All right, and then what about SOGI, right? Sexual orientation and gender identity. Not as many buckets as social determinants of health, but equally important to capture and recognize, right? So your gender identity is how you recognize your gender, right? So which can be different than what you were assigned at birth. And of course, sexual orientation is that gender that you are ultimately attracted to, right? Sexual orientation, gender identity is critical to ensure that the best health outcomes for the unique needs of the LGBTQ plus patients. The slide's kind of intentionally brief. I'll sort of touch on why a little bit later. Okay, the importance of social determinants of health. Folks might be familiar with this slide. It's kind of the one of the best examples of just disparity. Best examples, worst examples. Choose your side there, right? But the Delmer Boulevard, this one line, or in this case, a boulevard that just has such wide disparities between the two. And this really piggybacks on that quote about your zip code being a better indication of your health than your actual genetics, right? You can see, I don't have to go through everything, but home value, income, just massive disparities. And it's just, you can wave to people across the boulevard. And I'm sure everyone can think of a similar situation in your communities. I know that I can certainly identify that. I live in Rochester, New York, and it's easy to walk around and see, these things in real life as well. All right, so talked a little about what social determinants of health are. So why should you care? We have this survey that was put out by come back to me later, I'll tell you. But the question that was asked was, what social determinants of health does your organization capture at the member or patient level? And I won't go through all the reasons listed here, but suffice to say, a number of organizations are absolutely thinking about it. So it's a little bit of a wake-up call if you aren't really thinking about it at your organization, because it is something that's going to become more and more increasingly important over time, both in value-based care contracts or government mandates or otherwise. So let's talk about some of the challenges of working with these types of data. Right, data capturing that data is the first challenge. Right, without having that data, there's nothing that we at Arcadia or anyone's going to be able to do for you from an analytics perspective. So being able to capture and integrate these types of data is very important. Other challenges, inconsistencies in SDoH terminologies and codes. Having a set standard of terms for SDoH is not really something that is widely agreed upon at this point. So it can be a challenge to analyze a data set when you have so many different types of ways to describe that. Of course, privacy and security is always paramount with healthcare data in general, but SDoH and SOGI can be sensitive topics. So that could cause a little more stress from folks, which also kind of dovetails into the last bullet, hesitance to capture SOGI data. And I found a study in a healthcare journal that mentioned that 80% of providers were hesitant to ask their patients about SOGI, about sexual orientation and gender identity, worried that they would somehow offend them, when in actuality only 10% of the patients said that they were worried about that at all, right? So there's an obvious disparity there between, a provider or otherwise, capture of that data and what the patients are actually willing to share. Okay, managing this data in the Arcadia data platform. I won't linger on this slide for too long. At 4:30, we have another presentation that's going to really hone in on the Arcadia Lakehouse here. So if you're interested in that, hang out, and we also have a happy hour then. So if you need an excuse to hang out, I think you got it. But so we have all the different types of data that can be fed into the Lakehouse on one side. Well, a sampling, I won't say all, right? But we have scheduling data, your standard EHR data, lab data, social determinants of health, health information exchange. All this data is coming into our Lakehouse to allow and enable downstream analytics. So it's very important to normalize the different ways that this data can come through into the system, and also allow for interoperability, right? Sending that data back to the point of care so that they have an understanding of this as well. Here is, oh, do I have to press play again to start it? Yeah, there we go, great. So here's an example of a product that we have in our Arcadia console, what's called the term mapper. So this allows our users to find these, these data points and map them and standardize them, right? All these disparate sources can be calling things differently, but you need a unified concept if you have any chance to do any sort of analytics on it. So here's just a quick example of, the different terms that one can map to. And this isn't just for SOGI or just for social determinants of health. This is something that we use to maximize the value we can get out of any clinical record, whether it's a healthcare questionnaire talking about, depression or alcohol screening or otherwise. But we at Arcadia really put this tool in our users' hands. Historically, we used to handle all these sort of mappings internally, but our customers know their data better than we do. So let's build a tool that they can, short circuit us and just get value for these things as quickly as possible. And then the best part is visuals, because they speak for themselves. But here's an example of something that our customer insights team put together, highlighting the ability, or really what unlocks when you're able to have social determinant of health data. So on the left, we have some comparisons in terms of population that has at least one noted social determinant of health against the core population. And I don't know how well you can see from the front, from the side, it's just a sea of pixels, but there's some vast disparities, and perhaps not surprisingly, right, in the cost associated with patients that do have at least one social determinant of health. And it's on the cost side, it's on the number of events normalized per thousand, and it's really interesting, and you can imagine how powerful it could be to see your population stratified in these cohorts and come up with means to attack that and bring some resolution and help patients get the care they need and reduce those urgent care visits or whatever the case may be, right, by enabling them and ensuring that their social determinants of health aren't preventing them from getting the care that they need. So I mentioned earlier that SOGI, I sort of glossed over that a little bit. It's it's not a new concept, right? But it's certainly newer in terms of organizations effectively capturing that data, right? Which really is the problem at this point. This is, really a hypothetical. Well, it's not a hypothetical dashboard. It's a legit dashboard, but without that underlining data, it's not going to be that useful. So we're working with our customers to help them capture this data, and this is the type of insight that you might be able to surface, right? And again, the LGBTQ plus community has very unique health needs compared to, any other cohort you could imagine. So I think it's easy to think of the insights one could gain from this. And again, this isn't something that we're really able to garner insights from right now just because of the availability of that data. But sooner rather than later, it's gonna be mandated, and so getting ahead of it is, I think, is going to be very critical.